A very good morning and hearty welcome to all the esteemed and renowned dignitaries, faculty, and delegates. Myself, Dr. Ganavi and Dr. Hariprasad feel extremely elated to welcome everyone to this much-awaited conference, that is the 63rd Annual Conference of National Academy of Medical Sciences, NAMSCON 2023, hosted by us, Ramaiah Medical College, a constituent college of Ramaiah University of Applied Sciences, in the beautiful and elegant garden city, Bengaluru. It gives us immense pleasure to be amongst the most esteemed personalities who have won accolades in their respective fields. Coming together is a beginning. Keeping together is progress. Working together is success, by Edward Hale. Growth is never by mere chance. It is the result of forces working together, by James Penny. Diversity is the art of thinking independently together, by Malcolm Forbes. So these quotes illustrate the importance of conferences, which are a pivotal part of the scientific enterprise and essential vehicles for driving innovation.
The primary objective of the National Academy of Medical Sciences Conference are to promote excellence in medical research, education, and healthcare delivery in India. The field of healthcare is constantly evolving, and it is crucial that our faculty and students stay up to date with the latest advances and innovations. The 63rd Annual Conference of the National Academy of Medical Sciences here at Ramaiah Medical College, Bangalore, forms an important avenue for researchers to share and discuss research findings, to exchange ideas and insights, and to network for collaboration nationally and internationally to further our careers in all healthcare sciences, which include medical, dental, physiotherapy, nursing, and other allied healthcare specialties.
This conference will cover a wide range of important health domain areas, including digital health innovations, health and professional education challenges, non-communicable diseases, infectious disease surveillance, dental materials and innovations, novel drug delivery systems, rehabilitations, and advances in healthcare through scientific sessions, workshops, symposia, and panel discussions. Organizing such inclusive and useful scientific meetings has always been a significant responsibility of the National Academy of Medical Sciences, a unique institution fostering and utilizing academic excellence as its resource to meet medical and social goals.
I take this opportunity to express our appreciation and gratitude to all of our honorable speakers, panelists, and chairpersons who will be joining us today. Without further ado, we request each of you to sit back and enjoy the rich scientific content offered today, with focus on digital integration in healthcare professional education, digital health for advancing NCD care in India, industry-academia collaboration in digital healthcare, women in medicine, healthcare professionals as innovators, followed by a valedictory ceremony in the evening.
The first theme of today's session, a thought-provoking one, is on digital integration in healthcare profession education. The unequal distribution of health workforces across low-income, middle-income, and high-income countries pose a challenge. To enable an increase in a more equitable distribution of competent health workforce, there is a need for more effective and accessible health professions education, which can be overcome by digital technology and has gained a lot of priority during the pandemic. So to highlight the role of digital integration in healthcare profession education, we have 3 plenary sessions followed by panel discussion.
It's my utmost pleasure to invite onto this stage our chairpersons for this thematic session. We have with us my dearest teacher, Dr. Chandrika Rao, a professor of pediatrics. She's the driving force of the medical education unit here at Ramaiah Medical College. She's the director. And joining her today, we also have Dr. Suman, a key member of the medical education unit of Ramaiah Medical College and a professor of community medicine. We welcome you, ma'am. We welcome you, ma'am. To start things off, we have with us today Dr. Avinash Supe, Professor Emeritus, Department of Surgical Gastroenterology at the St. G.S. Medical College and Hospital, Mumbai, who will be sharing insights on digital technologies in teaching and learning. Sir has held key posts across the country and as a former director and dean in multiple institutions. He has been the past secretary of the Asia Pacific Hepatobiliary Association. He was the past president of the Indian Association of Surgical Gastroenterology and the past president of Academy of Health Professions Educators of India. He is to be noted that he was the founder director of the GSMC Famer Regional Institute and a Famer Fellow himself. Ex-chairman of the Expert Group of Medical Council of India. He has been on the editorial boards of multiple journals across the country and has been the recipient of the prestigious Dr. B.C. Roy Award and multiple awards in different areas. 53 awards in total. He has more than 300 publications and has authored many books and chapters. He has numerous orations to this credit. And even with all this, I don't think I have made justification to this rich area of expertise in surgical gastroenterology and in the field of health professional education. Apart from his achievements, it is to be noted that he is very keen in trekking and photography and has had trekking across the country, including the Himalayas and the Antarctica. And I won't hold you to it. Over to Dr. Supe to start off.
Sure. Thank you so much for those generous introduction. I think thank you, Ramaiah College and the NAMS for inviting me. It's such a well-organized conference. I would really appreciate everyone who has done this. What I'm going to really speak today is digital technology in teaching and learning. I must tell you, all of us started with Blackboard when I was in school at that time. And then from there, we have jumped to the now smart boards. So we have seen the whole how it completely changed, revolutionized the whole technology. And now I think the young generation has started with the virtual reality, and I don't know where they will really go. But I'm just going to tell you what is currently been the going on into the technology. So what will shape the clinical practice in future, if you ask me these questions? There are 4 things which will change. One is the technology. Second is the changing doctor-patient relationship. The third is pseudoscience, and fourth is a disinformation. So today we are going to talk about technology. What is technology going to change? So if you see emerging technology in teaching and learning, so if you see there are initially, when I remember when the slides came in somewhere in 80s, we were all thrilled, 80, 82. Then came the PowerPoint and everybody was thrilled with the PowerPoint. But then after some time we realized that there was a death by PowerPoint. People started using the same PowerPoints many years without any changing, and people started sleeping in the classes. And I think the whole educational technology really killed the education. Then came various kinds of these programs. Then the next thing came, which was simulation labs. All kinds of mannequins came, and today I think most of the hospitals, colleges have at least a basic simulation lab. Some of them have a very advanced simulation labs. Then I remember that time we also did cadaveric labs. I did cadaveric lab work somewhere in 2002, 2003. At that time, people were asking me, why are you doing it? I'm sure Ramaiah has a wonderful cadaveric lab now and they do wonderful work. But I remember when we started using it for various laparoscopic surgery, it was an innovation somewhere in 2004. The next thing which came was the 3D printing. The whole patient along with the pathology is printed, and look at this particular video.
Meanwhile, the
surgeon is operating and there's another 3D printed patient is being operated on the other side.
On the right,
and they are watching how surgeon is doing, and they are exactly replicating that. And they would bring out something like that from a 3D printing. So 3D printing is nothing but replica of the patient along with the pathology. Now 3D printing is common now even in India. Like an institute like mine, who has a public institute, we used to print for liver and brain the complete pathology. So before operating a patient, I know now where I'm going to operate. So there is a lot of change which is happening into this. The next thing which came into the literature or into the mind was virtual reality, augmented and mixed reality. Now what is all this virtual and augmented reality? Now I'm sure real environment is what we work with patients. Augmented reality is augmented with the digital elements. Augmented virtuality and virtual environment. And when you all mix it together, it becomes a mixed environment where there's a real and virtual objections. Now, if you really go, there is something called as an extended reality. Now, all these words will probably, when you start reading about them, you will realize how technology has completely changed over the way we teach our students. And it could be a low immersion technology versus high immersion. That means it could be a simple technology versus you are completely immersed like a gamification. Look at this girl. She's trying to learn laparoscopy and she's trying to prevent a ureteric injury. And how she gets feedback.
Greatest safety zone with both the ureter and rectum at safe distances.
Well done. In what direction would you place the suture? Speak the color of the correct arrow.
When we're placing sutures, our area of maximal control is the entry point. So we're going to put our entry point from lateral to medial, as that's going to be closest to the ureter.
Now, see, she's learning all this on a virtual reality, and she's also trying to get a feedback. She's trying to prevent errors. Now, this is all something which we never used to do before. We used to learn on patients. Today, we have done hundreds of this. I have got and some kind of a skill, and then I'm going to try it on patients. So, increases the patient's safety tremendously. Then came the new one, which is currently is the mixed reality or HoloLens. Now, this is large virtual 3D image. You take a CT or MRI and put it into the machine. Now, HoloLens 2 is currently one of the best thing. It's interactive, it's sharing. You can have, I am here in Mumbai, you can have in Bangalore, somebody is in Germany. We can have and talk together. A teacher can be anywhere in the world and student can be anywhere in the world. We have tried it in many countries now, and it works so well that you don't have to be there on the spot, but you can guide anybody from anywhere. Now look at this lever. I can create a lever like this. I can create a lever of this whole auditorium size. I can hold it, rotate it. I exactly know where is the vessels and how I'm going to operate. Extremely thrilling. You know, something like that which was never there. I can really work on these kind of digital technologies and get what you want to do. And look at the intraoperative image. You know, I can cut a lever and put it at the time when I'm doing surgery. Now, if I know exactly where I'm going to cut, how much of safety I'm going to bring it to the patient's liver resection. Now, this is true with lung, this is true with the everything. And you know, these are not something which I'm talking from, which is not now. These are all available today. And I remember last 1 or 2 years, we have been working in Nepal. And I think Nepal, Bhutan, these are the countries where we have gone and we have tried this HoloLens and it works so well. I think these are something which are coming up and we should really see that this is something which will remain in future. There's enough evidence in the literature today that these are all now use of technology and newer methods along with the current teaching will enhance the HPB surgeon's competence and pool. And this has been probably in every field you will find this is something which is coming up. And I think you go and read and trying to find out, it is much, much more fun than having play the Candy Crush. The next thing what you will find has come into fact is what is called as a learning analytics. Now, this is something which is going to change the way people are going to give feedback to your students. You know, people do a learning analytics. You know, people used to do video motion analysis. Like, say, I'm a laparoscopic surgeon. How I'm going to use my hands, how much I use my left hand, how much I use my right hand, and how do I do my surgery. Now, I used to look at my student and used to say, okay, you have done well. That was judgmental. Now we are bringing objectivity into this. For example, if you go into this, all of you know this is artificial learning, intelligence, then machine learning, and now is the era of deep learning. So what did deep learning added to the whole thing? What they call it as a deep learning with image analysis. Now they divide, this was a wonderful paper from surgical endoscopy in 21, and it really said that you take videos of various, say, laparoscopic cholecystectomy and put it into this, and they had 3 things: classification, detection, and segmentation. So what did they do? They used the convolutional neural networks and they found out anatomy detection, instrument detection, action recognition, phase recognition, and surgery duration prediction. I can even find out how much of surgery is going to remain based looking at the image. Now look at one example I'll give you, instrument detection. recognize the presence of a tool in a surgical field and detecting the location of the instrument, how much movement I am doing, like how many times I have moved a forceps, how many times the grasper, what was my range of motion. Now, if you find an expert moves instruments very less, but a young fellow moves instruments quite far, the risk is always more. Now, based on these analytics, I can always tell my student, okay, this is the area where you want to improve. This is something you would really work on that, and that's the way I assess my student, I guide him, and this is where what we call learning analytics is going to change the whole education completely. Tips and trends of using DT in TL. What has happened over a period of time? I'm sure the technology will, one side will always try to push us on the other side. There is a lot of teach student key soft skills by flipping the classroom. All of us have been trying to flip the classroom. We don't want to give lectures today. We want to extract from the student what he has learned. I'm ready to send my PowerPoint to student or my lecture or resources to student on the previous day. Let them work out them. Let my interaction time be much better for discussion rather than giving a talk. I think it's time we should all shift to the flipped classrooms. The time for those long PowerPoints have gone. I think let's close them. In fact, we are still saying that we want. In fact, I remember when we put CBME, we tried to put 1/3 should be lectures. I think we should have put only 10%. But we still find people continuing to have those lectures. Now, there are utilized online tools for improving collaboration. I should not tell to the young fellows, there are so many tools now available in 2022, including Moodle and Doodle and everything. But now there are so many tools which have come, and all of us continue to use this in our literature. Bring your own device for better understanding concepts. This is a concept which is coming up in most of the colleges. People want laptops to be there. And now I can give you tasks, I can ask you to really come back. And I can really work and assess you on the spot. In-class poll, in-class quiz, Kahoot and all, and I'm telling you so many things which have come, which I can make the students much better. I can give them instant feedback. Gamifications has come and it has been there for many years. It has not picked up very well, but gamification is one way by which the new digital tool by which the teaching learning was used. Better engagement of level of students, connects them with real world. It has reached up to some level, but it has not gone up to the higher level. Now there are types of digital techniques, blended learning, distance learning, telemedicine somebody talked about, e-learning, flipped classroom, and online learning. All of us, we have faced this and experienced this during the COVID time. But some of these concepts need to be continued in today's world. We need not all the time sit in a classroom. Sometimes I'm sure we should have all these extra time on the spot, and all these kind of things need to have, and face-to-face, instead of face-to-face, we can all have these kind of trainings have to be there. Now, what are advantages of technology? Let's go one by one. It's a wide access to the knowledge. Knowledge has expanded tremendously. And I think we should not really, now everybody has on a mobile his own library. My loft, my library on fingertips, up to date, clinical key, whatever you say, there are so many things which are now available on my own mobile. I can access it. The knowledge has exploded too much. And I'm sure my residents today, if I say something, some of them will go and find out on a mobile whether I'm telling is right or wrong. And they will tell me back, sir, this is what it is. The new concept says this. I have to respect them. 24/7 access to them. Better engagement and immersive learning. Promotes collaborative learning and SDL. We have to really see that the students do self-directed learning. I don't want my students to be only taught. I want them to explore. I want them to find out and ask me questions. I think they can do it better with digital technology. Makes it, of course, interesting. Students take more responsibility. This is the advantage of digital technology. Easy to remember, saves time. I don't think we should now start asking them questions for only memory. We should ask them questions about higher levels of cognitive level. I want them to go on to comprehension. I want to go on to interpretation, analysis. I want to go and ask them how much of cognitively they take decisions. I don't want to ask them questions like, what is the length of the esophagus 23, 24, 25, and 26, and you tick one answer. No, that's not the kind of MCQs I want my students to answer. I want them to answer much more questions. Digital technology will help me to do this. Use of AI for deeper assessment. I'm sure Dr. John is going to talk more on this, but AI has completely changed the way assessment can be made. And quick feedback. Sorry. Okay. Other advantages of digital education, online lectures, which are now, I think I can take a lecture and whole India can listen. Interactive technology to replace hands-on learning. Online examinations they're classically done by DNB during the COVID times. And teleteaching has been picked up. You know, I remember when we trying to do first projects in 2008, we had to explain everyone why we are doing teleteaching. You know, I remember there was a project by one of our fellow, and she wanted to teach and update the military people at the Siachen glacier through teleteaching. And there was so much of resistance to her. And during COVID time, everything changed. So there are different digital assessment tools. I will not go into details, but imagine the number of tools which have come. You know, we used to only know Moodle, but now there are so many like this. And the 10 most popular digital assessment tools for students and teachers. So different digital assessment tools are crucial component of current education, and they can assist teachers in monitoring students' development, identify areas of weakness, and giving prompt feedback. Yesterday we talked about precision medicine. Today is the era of precision teaching and learning. Today we have to teach students what they lack. So I want to know, everything doesn't fit all. You know, I think there are so many students at different levels. I need to find out what is remaining in one student and what I should really teach him. So this is something digital education will do. Technology is a powerful tool that can support and transform education in many ways, from making it easier for teachers to curate learning materials to enabling new ways of people to learn. With worldwide reach of internet and easy accessibility of smart devices, a new age of education is drawing. There are, of course, disadvantages. Missing human touch. Developing e-content is a task. Students' behavior and distraction. Students will start seeing movies on the hall when I ask them to bring laptops. Higher cost of education, reduced social interaction. Right tool for right purpose. This is the question. You know, we have too many tools. How do I select a right tool for right purpose? Needs creative use and difficult to train senior faculty. You know, very few people cope up with the digital technology. I find very difficult to teach professors and associate professors. Lecturers and students learn very fast. The problem is with professors. Internet access, of course, and environment needs to be suitable. Teachers' role in digital technology. If you see, using technology and tool, teacher must ensure learning needs of every student are met. Teacher should record how information is received. Using data analytics, teachers can experiment with different pedagogic styles and ensure improving individuals and collective performance of students. So in conclusion, I must say, we must embrace technology. Technology is there. Don't remain away from technology. Don't get scared of technology. Accept technology. Technology should be an essential part of education. Clinical medicine is very good today, but we also need technology to confirm, treat, and remain legally safe. And this is a new paradigm which we are seeing. Today, previously I used to put my hand and say this patient has, say, liver abscess or something. Today, I need a sonography. I need maybe a CT scan to confirm what is the kind of thing which I'm dealing with. Tomorrow, if somebody goes in court and I don't have a technology support, people will ask me. And this is something which you should remember. So what is way forward? Technology is rapidly changing. Its clinical benefit needs to be seen in future. Though we have changed from blackboard to smartboard, we feel very happy. I'm sure just because we are using technology, it doesn't mean our students are going to be smarter. What we need to inculcate in them is higher levels of cognitive skills, higher levels of skills, performing skills, and higher levels of attitudes. Yes, attitudes also can be taught with technology. Today, there is an artificial intelligence in communication also. It will tell you exactly what is wrong with your tone, what is wrong with your behavior, what is wrong with your communication. I think all this can be easily found and given you feedback. Embrace technology, but keep the clinical wisdom and human connection. Always look beyond numbers. And this is something which we have to be remember when we are using technology. You can get immersed into this technology, but forget the purpose for which we are doing it. It's not technology versus humans. It's humans and human technology working together to achieve better healthcare. So it's how we use this technology is very important rather than using technology. We have now too many tools. It's a problem of plenty. So, once upon a time we were struggling with problem. We were not getting only technology. Today we have too much of technology. So how do we use that technology? It's a paradox of choice, what we call it. Artificial and humans are the most potent when they cooperate. They will never replace each other. And I would end in saying that, why do I say this? Artificial intelligence came much, much earlier in this aerospace. But today, will you travel in an airplane where there is no pilot? So probably I would travel in a plane who has a pilot who understands AI. So I think the same thing we should apply for education. Thank you so much, and I would really appreciate you.
Thank you, sir.
Sure.
Any questions? Anybody would like to ask? Questions we will take in the panel discussion. Thank you, sir, for an insightful and a stimulating presentation. Your talk was particularly appropriate at this time when we are considering new initiatives for the use of digital technology in our institute as a teaching tool. So going